Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
Hey people, this is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to welcome you to episode 33 of the Ask Dr. Angela podcast. My wife and I were at a party not too long ago, and we met some really fabulous people, and we were talking with a young lady, and I'm going to say that she's young because she was our age, and she was telling us about, I guess her job requires her to do a lot of entertaining, and she was out really late one night and went out dancing and drinking. And folks in my age range don't really do that often. It's not that we don't do it at all, but it's not like when we were like in our 20s or maybe even early 30s when, you used to go out and just do it. Drink, have fun, dance, not really care. And so we were talking. I'm like, oh my gosh, aren't you so happy that you're like married and you don't have to like do that scene anymore? And we were all just so happy to have families and to be married and to just not really have to deal with all that young people have to deal with these days. I mean, quite frankly, I find it kind of scary. I see women from all ends of the spectrum, young, older, and just flat out old. And, I love seeing all of them, but I have a particular fondness for my really young patients. They are just entering into adulthood and, they've got like their whole lives ahead of them. So part of my interaction with them is always just kind of seeing where they are in life. Of course, we do like the whole medicine thing, but I'm really always interested in what people's goals are, what their aspirations are, and kind of where they are in their journeys. And it's always so fun to listen to what they have to say, whether it's talking about family, friends, new relationships. So of course, part of my history taking when I'm talking to anyone, but specifically my really young patients, is safety first. And I don't care if it's dealing with drinking and driving, texting and driving, wearing seatbelts, and practicing safe sex. And part of that for me is I don't define safe sex for people. I ask my young people, so what is safe sex to you? And let them tell me. I don't assume that people are in heterosexual relationships. They could be bisexual, homosexual, that's their business. But my job is just really to make sure that people are safe. So I was talking to a young lady that I met a couple of weeks ago, and she was in for an annual exam. And, she said to me, Dr. Angela, can I ask you a question? And so, of course, I'm like, yeah, you can ask me whatever you want. There is nothing that is, off limits in this office, or even if we're not in the office, just in general. And so she says, well, I'm seeing this new guy and getting ready to take it to the next level. And I just want to know, how do I talk to my new partner about STI screening? And so I looked at her and I'm like, are you serious? And she says, yeah. I mean, how do you do that? And I'm like, well, you do it just like you just did it with me. So it's really like a no-brainer. And I was so happy actually that it came up because, I tell my young people all the time, women go to the doctors all the time. We get annual exams. Men, boys, hardly ever go to the doctor. So every year when my patients come and see me, they can leave and a week later get like a clean bill of health or something that says, boom, I don't have HIV, I don't have hepatitis, I don't have gonorrhea, I don't have chlamydia. Granted, we've done like a full STI panel, but it's very easy for women to have this kind of documentation. And so I just said to her, this is what you do. You go out on a date, go to the movies. For one of your date suggestions, you say, you know what, we're both going to the clinic because I have paperwork that says I'm clean. And if you don't, then you both go to the clinic together and you say, we need to start this off on the right note. So I'm going to get tested. You're going to get tested. And then once we see that everyone's on an even playing field, i.e. not bringing any STIs to the table, then boom, we can play. Everybody's happy. Just that easy. So I always say to folks, people are only as uncomfortable as you are. So if you're comfortable with it and you just kind of broach it and throw it out there very casually, no one should have a problem with it. And while you're in that phase of getting to know each other, talking about STIs, just make sure that you get a really thorough sexual history on people. See what their sexual practices are, who they're sleeping with, so that you can make an informed decision on whether or not this is something that you want to partake in. Excuse the play on words there. The other thing that I always ask my folks when I'm talking to them is, are you in a mutually monogamous relationship? And most of the time they say yes. And then I also ask them, is the person that you're sleeping with in a mutually monogamous relationship? Because that isn't always the case. So just make sure that you ask the questions. Make sure you're sure. It's just that easy. Remember, it's only going to be as uncomfortable as you are with bringing it up. And it's your health, so your safety first. Don't be afraid to ask what needs to be asked. I certainly hope that this episode has helped somebody. I thought it was a really great question and one that I'm addressed with a lot. If you have a question or a concern or just a thought that you would like featured on the Ask Dr. Angela podcast, please submit it. Go to www.askdrangela.com. That's AskDrangela.com. Click on the microphone on the right-hand side of the page and do what you do. If we use your question on the podcast, we will send you one of our bomb-ass t-shirts. And if you think about it, check out the Say What blog. It's a blog by yours truly. It comes out every Wednesday, and it alternates between an obstetric and a gynecological topic. And it just features questions and thoughts that are generated by you. You can sign up for the Ask Dr. Angela blog at the same website and click on the Say What blog. It's like, say what? In closing, I'd like to leave you with this thought from Robert Kiyosaki. Successful people take big risks knowing that they might fall hard, but they might succeed more than they ever dreamed to. Reflect on that and ask yourself, are you looking at the opportunities or the difficulties daily when you talk to yourself? Until next time, look better, feel better, be better. I cannot wait to reconnect on episode 34.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.